Tonight I'm massaging my knees and I want to show you how I do that. Reminder that I am not an expert, I'm just a regular massage therapist, but I thought I'd show you what I do for releasing knee tension. This is something I get asked a lot because usually when you are getting a massage therapist usually doesn't spend that much time around your knees. And I think the reason for that is that we just get so busy with like everything else. You need a lot of work in your back, neck, low back, shoulders. We're pretty busy. So it is a good idea to learn how to massage your knees. You may want to check with a physical therapist, a doctor, especially if you have like something actually wrong with your knees. This is more for regular everyday tension. So I'm just gonna start warming up. An easy technique that you can use on the knees is to take your palms together right above the knee. We're going to spread down, spreading down. It's a good way to get things warmed up. And we're really hugging the muscle, moving away this like, this extra stuff. Move that away so we can get to the muscle. On the inside of the shin, so right through here gets a lot of tension. So I'm just going to take my fingers and I'm coming along the bone. I want to get very close to the bone, but I'm not putting pressure here. I'm just sliding. I'm just moving all of the skin, the fascia, and anything that's clinging to the bone. And that alone can just feel so good, especially if you've been walking a lot, especially if you have something like knock knees where your knees come inward, more of the pressure is coming to the inside of the knee. Just gonna warm things up right around the knee. Again, not putting pressure. You don't want to put pressure. The real thing that we're trying to do is just move things around and get some blood flow to the area. I'm coming to the other side of the knee now, again right along this shin bone. Just now I'm putting a little bit of pressure along here, just kind of breaking things up. Anything that's clinging, again, just getting some movement through there. It's gonna feel really nice. Okay, the other place that I feel like gets so tight for so many people is right on the inside of the knee, but higher. So here's this bony part. We want to come just around. So we're kind of circling it. We're definitely not pressing into the bone, and we're not using a lot of pressure. Again, it's more just feeling for what's tight and then moving it. Pulling the muscle, giving it a nice stretch. We're gliding here. We're not putting downward pressure. That should feel like things are heating up now. There's more movement to the area. It's not so stuck. I do like to get on top of the knee because for me at least, like I have that anterior pelvic tilt, and this just gets so tight nowadays. So I am definitely going to work through here, and I'm just pulling up. I'm putting a little bit of pressure, but not down. I'm not pressing down and then sliding. I'm putting the pressure as I'm moving forward. So not down, but just grabbing onto it and moving it back towards your body. Or some people like it away. Some people like it down towards the knee. It's really up to what feels good for you. I personally prefer coming up towards me. That feels really good. This is very specific work. I am trying to stay close to the center of the leg. Oh, that's amazing. And then this part, so I'm gonna come to the side of my leg, the outer side of my leg, and I'm going to bring my palm up, and I'm going to, again with that, the pressure going forward, not down, moving the muscle. this will help take some pressure off the knee once we relax this muscle. Give it a nice little, and I like to bring my fingers and just kind of wiggle it. I'm not putting pressure, just a little wiggle. So nice. I hope that helps with your knee tension.